Hey everyone, it's Dr. Chan here. Today I'm going to show you how to do penile injections for erectile dysfunction. These medications that you inject into your penis are a good alternative to oral medications like Viagra or Cialis if they don't work well enough. The most common formulation that we try with is Trimix. It's a combination of alprostadil, phentolamine, and papaverine. Trimix should be stored in the refrigerator, and the medication lasts for several months after you open it. I'm going to turn it over to my nurse, Alejandra, and she will show you now how and where to inject this stuff.
Oh, hi, my name is Alejandra. I'm the urologist MA, and today the video is about how to do a penile injections. This is for patients that have ED problems and that the doctors prescribe Trimix, or it's a different type of medication that you have to inject yourself at home. So I'm gonna use silent water. This is just for teaching purpose. So basically what you're gonna do is you have to have your alcohol pads, your syringe, and your medication. Your medication all the time. Pull in some air on your syringe. So to draw your medication, you put in air and you're drawing the dosage that your provider indicate. When you draw your medication already, you're gonna put the cap for safety. Clean the area. With your right hand, you're gonna stretch the penis, clean the area, and always with 2 fingers, it's down of your pubic bone and 1 finger down of the tip of the penis. You're gonna use 10 and 2 to inject. You can switch the spots every day, so that way you prevent bruises or swelling and you don't inject the same part. You're gonna grab your medication, remove the cup, and you're gonna use your clock as your base, like 12, 1, 2, 12, 11, 10. So you're gonna do it on 10 and 2. Avoid your veins. So you're gonna start injecting the medication. It's low. You push the medication and make sure when you're done, put your sharp in a sharp container. Put some pressure to avoid bruising.
So just to recap, when choosing an injection site, you want to imagine that your penis is divided into 3 parts. You want to inject it in the middle third of your penis at the 10 o'clock or the 2 o'clock position. Each time you inject, you want to change sides. Don't inject into any veins that you can see, and don't inject straight down on top of the penis because there's veins, arteries, and nerves in that area. Some other caveats about giving penile injections. If you're taking sildenafil, vardenafil, or vadadifil, don't take these things within 18 hours before or after injecting. Don't inject within 72 hours of taking tadalafil because it lasts a little bit longer. Do not give yourself more than 1 injection in 24 hours. Don't give yourself another injection if the medication doesn't work initially. And finally, you can inject up to 3 times a week as long as there's at least 24 hours between each injection. One of the most feared complications of doing penile injections is something called Priapism. This is when you end up getting an erection that just doesn't go away. And a lot of times this can end up sending you to the emergency room, which can be very embarrassing. So if the patient has an erection more than 2 hours, what you can try to do initially is take 4 tablets of pseudoephedrine. If you have an erection more than 3 hours, you probably should go to the emergency room. And most importantly, don't give yourself any further doses of penile injection therapy if this happens. Well, thanks for watching this episode of Urology Made Simple on penis injections. I hope you enjoyed it and you learned something. Please subscribe below to find some other useful content.